Hi, everyone, and welcome to Leapfrog's ASC webinar. We're so pleased today to have Leapfrog's President and CEO, Leah Binder, leading an important conversation with Linda Schwimmer and Cassie Wilson. Throughout today's conversation, you can enter questions in the Zoom Q&A. If you look at the bottom of your screen, you should see the Q&A icon. You can enter questions at any time throughout today's conversation. And Leah Binder will be taking them at the end and posing them to both of our speakers today. As a reminder, this presentation is being recorded, and the recording will be posted on our website, www.leapfroggroup.org. We will also be sending it out to everyone who attended today's event. So thank you so much, and Leah, I'll turn it over to you.
Thank you, Missy. And thank you all for being with us today. We're very excited to speak with our two new co-chairs for Leapfrog's new ASC Advisory Committee. We have a co-chair who is from the Leapfrog Board of Directors, Linda Schwimmer, and we also have a co-chair who heads up the ASC Quality Collaboration, Cassie Wilson. So I'm really excited to hear from you both. Just by way of introduction, for those who don't know what Leapfrog is doing in this space, back in 2019, the Leapfrog Board of Directors observed that 60% of all surgeries were being done either in outpatient surgical units at hospitals or at ambulatory surgery centers. So we felt that it was time for Leapfrog to investigate whether we had a role to play in determining and publicly reporting on the quality and safety of ASCs. We also began to recognize just how important ASCs are to our healthcare infrastructure and to the future of our healthcare system. And we want to be part of that as well. We began actually collecting data on the ASC survey in 2019, and we've started publicly reporting it last year. And this year we have the next year of the ASC survey. So today we're going to talk to the two co-chairs of our ASC Advisory Committee about the business case. Why should ASCs get involved with Leapfrog? Told you why Leapfrog got involved with ASCs. So let's start perhaps with a question for let's start with Cassie. Cassie Wilson, you can tell us what is it about the Leapfrog ASC survey that you think is worthwhile for ASCs?
Well, quality measurement and public reporting of results are really essential for accountability and for improvement. So we owe that to every patient that comes through our doors. And participation in a survey such as Leapfrog really enables you to have a basis of comparison. Really important.
And Linda, you're on our board, so did I describe it correctly? Is that why we thought it was important to be involved in this world of ASCs?
Absolutely. As more and more care goes outside the hospital walls, so to speak, purchasers as well as consumers personally still want that same level of transparency when it comes to safety and quality, particularly when it's a procedure that they can plan and schedule, so it's not an emergency and they have a choice. The more information, the better. And we heard that loud and clear from our membership, our constituents, and from our loved ones, really.
Let me ask Cassie this question then. Do you think that there's a need for more information by purchasers and the public about ASCs?
Oh, absolutely. There's a lot of information that just hasn't been made available yet. A lot of quality information, pricing information, and a lot of centers are participating in data collection, but it's just not in a form that can be presented and made accessible to the public and to payers. So really important that we're moving in that direction.
I also want to say to our audience that you can, if you have a question that you'd like to ask either of our panelists, you can do so on the Q&A button at the bottom of your screen. If you don't see it, just hover down there at the bottom. You'll see Q&A, just enter a question and we'll and I will be picking up those questions as we go. I had the chance to tour ASCs last year. Well, actually before the pandemic, so I guess that's more than a year ago now. But I had a chance to tour a number of different ASCs and I was very impressed. One of the things that I was impressed by was I guess the only word for it is calmness. ASCs present all of them, and they were very different, presented a calm environment. They just were places where you felt immediately comfortable and somewhat relaxed. I mean, given that people go in there for surgery, I think there's always going to be a certain level of stress people feel, but it wasn't conveyed by the environment. And I think that is a real contrast with hospitals. Hospitals, by their very nature, they have emergencies. They never know who's going to walk in the door. The next minute, they have a lot of different kinds of treatments and surgeries and a lot of different events going on all at one time in the same space. That can create a sense of hustle and bustle, sometimes stress, sometimes just hustle and bustle, but it's not calmness that you see in a hospital. And certainly when you go to surgery, a calm environment is very enticing, a very nice way for families as well to be able to be with their loved ones during the time of some stress. So I do think that potentially ASCs do have some real answers to some of the issues that we have in healthcare, simply by presenting an environment that's so welcoming to patients. And somewhat that can be reflected in patient experience surveys. So I wanted to talk with you both about what you see in patient experience surveys and do you think they're important to employers? So let me start with you, Kathy. Do you see results of patient experience surveys from ASCs and what do you think about those, what the results?
Oh yeah, it's really a key metric for ASC administrators. And as you know, the OAS CAP survey has been developed and implemented at a lot of surgery centers, and that's given us great information and comparable information to HOPDs as well. But ASC administrators know how critical patient experience is and to their success. We have a very limited amount of time that we can impress with that patient with our communication and education and support as they go through a stressful situation. So it's really critical, even before the patient gets to the center, that any interactions that any staff member has with the patient is one that conveys confidence and empathy to that patient. So it's a short, compact period of time, but I think ASCs do a great job of engaging with those patients at all levels, in all departments and contact points.
And Linda, what do you think that patient experience surveys are important to employers? What do you advise employers to look for in those surveys?
Yeah, I think it's very important to employers and to the consumers and employees, which is why it's so important to employers. As Kathy mentioned, the information in advance, how to prepare, what to expect, what equipment or caregiver support you're going to need at home. All of this is going to make for a better facilitated experience and recovery and return to work or your daily actions of living. The other piece that's really important, both to consumers as well as to their employees, or employers as well as consumers, is ethical billing and transparency and clear information around pricing and transparency. The whole issue of surprise billing has been very much front and center in the news. We have a new federal law on that that's going into effect in January. And it's very important that consumers know what to expect. And that's actually, I think, one of the potential benefits, because there is more clarity in billing at an ASC in particular than, say, a hospital or other setting when there's various different potential ownership and contracted out types of departments. So I think that is that's another clear benefit. But it's people are getting more and more used to going online, looking at quality ratings, looking at report cards, safety grades such as Leapfrog and others. This is just how we make decisions, particularly when it's decisions around elective scheduled procedures. And so the more information, particularly on vetted measures, such as Leapfrogs, where we have a board of experts or a panel of experts that is choosing what measures and what questions and what aspects of the consumer reported outcomes. You know, all of this information is valuable to both purchasers and directly to the patient consumer.
Can also be valuable to the ASCs themselves, because it gives, I think, Kathy, you made the point about benchmarking. It gives you a sense of where you stand and where you can improve and where you're doing, exceptionally well. All of that information is important, and you can get that through those kinds of tools.
And so, it's information that you can't get from your internal benchmarks. So
right,
it's really critical. Yeah.
Right, you can know how you're doing, but not necessarily how you compare, which is kind of why your kid thinks they're doing great, but they get a D from the teacher. Suddenly it's not so great anymore. But not that we're giving Ds to the ASCs at all, but just that seeing how you compare really does make a difference.
I think too, it can be more timely information, which is also really important to purchasers and consumers. My organization was looking at inspection reports, and particularly where there were more grave concerns in terms of what was popping up in inspection reports. But the problem is, with the ASCs in particular, inspections can happen once every 4 years unless there's a particular complaint, which doesn't then provide you with particularly actionable information. And because the survey is annually, it's going to be more timely, more relevant.
Okay. I'm going to ask a couple more questions and take the moderator's prerogative that I get to ask the questions, but we do have a couple more questions coming in as well from our audience, and I do encourage, if you do have questions, to enter them into the button that says Q&A on the bottom of your screen. So one of the issues, I think, as we've started working with ASCs is that sometimes ASCs are not accustomed to participating in surveys like this and providing information about their quality and safety. It's just not, it's not something that's part of their normal daily operations. So what do you think, I'll ask this of Kathy, what are the core competencies that you think ASC should develop among their staff to support quality participation in quality measurement and public reporting?
All right, really good question. It's important for ASC administrators to be transparent, even down at the facility level. Starts there, about the metrics that drive their success. So each ASC staff member really needs to be familiar with how the center is doing on those metrics. So they have to individually be able to articulate how they, in their position, can impact those measures. So a key competency is developing that among staff, which obviously infers that all that data has to be shared with the staff. I know many centers post their performance data internally and go over it monthly with staff so that everybody's aware of how they're performing. Really important. It creates a lot of interesting conversations with the medical staff and among staff members when they're aware of those metrics. So it's really part of the orientation and ongoing education of staff. Engagement with patients, as we've been talking about, is another core competency and comes in actually in selection of staff and orientation and ongoing education. And this is the business office staff as well as clinical staff. So it's not limited to clinical staff. And along with patient engagement, it's also critical that the communication skills are developed among the staff. I always say you've got a piece of information in your head that impacts the care of this patient that is delivered by the next person. And you have to be able to communicate that freely without hesitation to anyone, including physicians, along the care path. So that those communication skills, they have to be developed quite often. So that's another key engagement. And just sharing that information along every step of the patient's care is absolutely key. So those are some of the main things that I think are important as far as competencies.
I would agree just on observations we've had just in the short time that we've been working with ASCs. Another thing I would add is that it's been galvanizing to the staff in a positive way. I think some ASCs, at least some that we've talked to as part of our case studies, for instance, have found that it's really exciting for the whole staff to see results, to be recognized for achievements. I mean, it's good for morale.
It is. It is. It really is.
And Linda, what do you think about what we should be doing at Leapfrog? You're on our board. So what should we, and we both really can answer to this question because you're both co-chairing our advisory committee. So we need your advice. Is there some way that Leapfrog could do more to support ASCs as they either participate with our survey or just in the movement toward quality in general?
Well, I think we're starting today. I mean, the purpose of this webinar is to tell ASCs the value of participating in the survey. So what's in it for you? And I can tell you from my own experience here in New Jersey, all of our hospitals, so by default, then their hospital outpatient as well, are reporting on the Leapfrog survey, but only 2% so far because it's new. And so we're going to get there, but 2% of ASCs. And so I'm looking forward to a much more engaged, robust environment where we can have more reporting. And I think that it is of value because it gives you a platform as ASC leaders to report on your quality and your safety in a timely way. It allows you to demonstrate through a trusted third party how you're doing on quality and patient reported outcomes and engagement, and also your ethical billing practices, which is part of that as well. So it really gives you a trusted platform to shine and to compete on quality and safety in an environment where we know people are paying more of the bill themselves and they're shopping and comparing and they're looking for that information. And so if you're doing well, people are going to come to you. And if going through this process, it enables you to focus on areas that you need to improve on, it gives you a framework to do that as well. And we've seen that happen with hospitals fairly dramatically. Focusing on these issues, having these huddles like what Kathy was just describing, really drive quality and safety improvement and performance. And so we're hoping to see the same thing with the ASCs and come back a year from now and be able to talk about the fact that we have 50% and then 75%. So I'm excited about this opportunity, and I hope that everyone listening is as well, and will start to report. And Leapfrog and the other organizations like mine across the country are really here to help and answer any questions and to facilitate that participation.
Leah, I always I think that ASC administrators and leadership and physicians are a very collaborative group. So as Linda said, this is a great start to connect people that are participating in the survey. And I think any opportunity that you have to get people together to network, whether that's in person or virtually or online, always is appreciated.
Kathy, what do you think about Leapfrog's plan, which we're going to start in August, to compare ASCs side by side with hospital outpatient surgical units. Do you think that that's you think that's a good idea, or and what?
Oh, absolutely. We are really working with CMS and other measure developers to develop measures that make the metrics comparable. And as more and more procedures move to the outpatient environment, it's both HOPDs and ASCs. It's important that people have access to that information and know what the differences are. So, and I don't think there's always a really solid understanding of how much different it is to go into a hospital environment, even if it's outpatient, versus into an ASC. Some of the things that you were talking about before. So, and then the other thing is, as procedures are moved out of the hospital, we have a responsibility to measure the outcomes and the results, so that we can support, further migration of procedures that are appropriate to be done in the outpatient setting.
Would you agree with that, Linda?
Oh, yes. And I would to add to what Kathy was saying, purchasers are signing contracts and building out their plan design to really incentivize their employees to have certain procedures in an outpatient setting if it's medically appropriate for them. And so I think that it's important, if there's going to be out-of-pocket economic difference for those patients, that they have the same level of information in terms of the safety and the quality of those facilities.
I think one of the philosophies we've had has been that we have to provide information to the public that's important to the public. So the priority is what's important to a consumer, and consumers don't really care about the structure of the place that holds the OR. They just want to know, am I going to get a safe, high quality surgery at these places? So they don't really care whether it's an ASC or an outpatient setting necessarily, as long they just want to know how high quality it is. So having them all compared side by side, I think, is consumer friendly as well. But all right, I'm gonna bring some questions up from our audience, and then I'm gonna I have a couple more, but I'm gonna hold them off for now, so we get our audience here. We have a question. It seems that most consumers don't realize that ASCs aren't regulated or inspected with the exact same rules as hospitals have to follow. They just assume it will be just like a hospital, except maybe less expensive. So how does reporting help address this information gap and make sure that ASCs offer high quality, high value care to patients? Kathy, do you want to address that issue? Do you think that?
Yeah, well, I think there is a misunderstanding that ASCs don't have a lot of regulations in place, and when they indeed do. And not only federal regulations, some of which are very similar to what hospitals have. Obviously, the departments aren't as vast or as comprehensive. But then they also have state regulations that they have to follow. And the state regulatory bodies also survey the centers, in addition to centers becoming accredited by various accreditation organizations. That being said, that, as we talked about before, sometimes that information is not readily available, especially to consumers. So one of the things that we need is to be able to see the data, particularly from CMS quality reporting, and be able to have people able to access it. So we're working with them on more accessible data from CMS, but also then as an adjunct to that, any quality reporting that can be publicly posted and available to the public is going to shine a light on that, shine the light on the quality and the safety aspects of the ASCs.
I was just going to say, transparency builds trust, and
Correct.
that's going to be very, very important. There are differing regulatory environments, clearly, and lots of issues to address in the long run around that, and lots of arguments to have about that. But fundamentally, transparency is what's going to drive trust in the market, and it's going to get people the best care ultimately. Linda, did you have a comment on that too?
Yeah, I just wanted to add to Kathy's point about the level of transparency. The benefit of Leapfrog and participating in this survey really is a lot of those inspection reports. So some of them are available publicly. A lot of them, for instance, if it's done by a vendor that's hired by CMS, a lot of the information is not publicly available. And even when it is publicly available, the way it's structured, unless you have a clinical background, it's not consumer friendly. It's not really accessible information. And that's really where Leapfrog comes in. So now you're reporting on something that's built for consumers. It's built to be understandable. It has the benchmarks, the explanations there. It's really done for that purpose, which is really different from the inspection information, which was really done for the purpose of having an inspection and then having a plan of action if there was a problem. And so that's why this gives you a platform and a forum to have your information put out there, and you can compete on quality and safety, and consumers can see it and understand it and benchmark it. It's a very different thing. Both are important, but this is really for consumers. And I think that's the important distinction.
Yeah. All right, we have another question, and this is one as a parent, I'm quite interested to hear the answer. We hear a lot about adult surgeries moving out of the hospital. What about pediatric surgeries? The question was for Kathy. Are there many ASCs performing same-day surgery on pediatric patients? And do you think this is going to become more common?
Well, I think that we'll probably see continued just migration of cases out of the hospital, but we do have a lot of ASCs performing pediatric surgeries, but what's key in pediatric is the specialties that are, and quite typically in peds cases, it's going to be ENT, sometimes dental, maybe a few orthopedics, but primarily you see a lot of ENT procedures that are very appropriately done in the outpatient setting. This migration that's taking place out of the hospitals is primarily adult-based cases. So things like orthopedic, joint replacements and cardiac procedures are primarily adult procedures. So it's not, there has not been a focus on moving pediatrics that are hospital-based out, because so many of them are already appropriately done in an ASC setting.
But I think I have been surprised myself as we've gotten to know ASCs, how many pediatric patients they have, how many children use ASCs, and I think that could be very positive. So it'll be interesting to see as we go the safety and quality metrics.
Important to have the staff that's obviously trained, has specialty training to take care of those little bodies. Yeah.
Yes, they're, as they say, they're not the same. They're not little adults.
They're
right. It takes a special touch with children. So, as we all know as parents too. So we have a question about the status on ASCs reporting any surgical site infections. I know that they track them internally. This is the question. I know that they track them internally, and as more complex procedures migrate into the ASC space, this could be an important metric. And I think that's through the NHSN, right? That's through the CDC's NHSN that SS surgical site infections might be reported, or are there? It's difficult sometimes to track them because the infection symptoms might not show up until after they've left the ASC. But Kathy, do you want to speak to that? How are SSIs, I guess, how are they tracked now by ASCs, and what do you think are
Yeah,
the
I would say that's an accurate statement that many of them are tracking them internally. And then to any extent that there are SSI measures that have been standardized and through work with CDC. An example is breast surgery. We did a lot of testing and working with CDC on that measure. But it is important, and we are currently working with the CDC to standardize some definitions and perhaps pull in some of these procedures that are moving into the ASC space, the outpatient space, such as the joint replacements. Absolutely critical outcome measure to know what the infection rate is on those cases that we're now doing in an outpatient setting. So this is a big focus for us right now, and in conversation with CDC about what additional measures that we need to look at, and how can we make it easier also for the ASCs to report on them, because it's a pretty complex process for them to report infections into NHSN.
Okay, I think we have a couple minutes, just 1 minute left here. I'm going to ask you a question. Crystal ball, where do you see ASCs in the future? Do you see this as do you see ASCs as having a critical place in the U.S. healthcare system, growing, or do you see this as we are where we should be and not going anywhere else? All or anything in between?
Well, I think we've seen the movement starting, and I think that it's only going to continue, but we need to support that movement of appropriate cases by making sure that we have demonstrable data showing that our outcomes are excellent. So anybody that's not currently gathering these metrics and making them publicly available certainly needs to prepare themselves for that. We've got to do our part in this movement by demonstrating that the cases can be done here with safety and quality in mind. So really important that we prepare. And I think that's a great question to bring up. And I think that the movement is just going to continue. If nothing else, as technology advances, it supports more complex cases being done in the outpatient setting.
Yeah, I really like the word that Kathy just used, appropriate, the appropriate cases. So I think that the measures will really be important to make sure that ASCs are taking the appropriate cases, and where it's not appropriate, it stays in the, it stays at the hospital setting, and that we have the transparency around the quality and the safety. And in that vein, I think that we're going to see a lot more moving to the ASCs, and I think that's a positive development for purchasers and for patients.
And what about public reporting for ASCs? Do you see that as the future?
I do. And I think that, Leapfrog's at the vanguard of that. And I think that is participating in the Leapfrog survey is only going to give an advantage to those facilities that are starting now and getting used to it. And as Kathy said, really building it into your process and your culture.
Mm-hmm. Okay, well, if our producers of our webinar can let me know, do we have a little more time, or I just want to make sure I'm on time here. Because we have one more question or a couple more.
Yes, Leah, we are about 5 minutes over.
Sorry.
So
Okay. No, we don't have the time. I'm sorry. But we'll send the attendees answers. We'll ask our panelists if they can spend a few minutes to answer some of these questions that came in, and we'll send them off to you all. But I do want to thank you both. Thank you for these very insightful comments, and thank you for being part of and really leading our ASC Advisory Committee. We do encourage nominations to that advisory committee. They're due by tomorrow. Please check our website for that information. And we, again, thank you both for your leadership and your insights. And I think we have a very, it's been inspiring to listen to you both. I think this is exciting direction for our healthcare system. So thank you all.
Thank you.
Thanks, everyone. Have a wonderful afternoon.